Alright, go. You're good.
Hello, my name is Mohammed. I'll be your student nurse and I'll be performing a quick head-to-toe assessment on you. Is that okay? Alright, thank you. First, I'm going to perform hand hygiene. Put some gloves on. Can you please tell me your name and date of birth, please? Alright. And I'm going to check your ID, and that matches. Patient appears stated as age. Facial expressions are normal. Patient's behavior is normal and calm and cooperative. Patient's hygiene is good and clean. His hair is combed to the side. Can you tell me why you're here? Do you know where you're at? And can you tell me what time is it? Alright, so patient is alert and oriented ×4. And now I'm going to grab a quick set of vital signs. I'm going to come on this side. Alright, so first I'm going to get the apical pulse. And I'm going to listen to that for a full minute. And I got 70 beats per minute. And then I'm going to I'm going to feel the radial pulses both bilaterally. And I'm going to assess for rhythm. The rhythm is regular +2 strength. And I also got a 70 beats per minute on here. Alright, so I did my apical pulse, I got my radial pulse. Now I'm gonna assess for oxygen, or respirations I mean. And I'm just gonna have my hand on the chest over here. And then the normal is 12 to 20 and his respirations were 14. So that's normal, and now I'm gonna assess oxygen level. I'm gonna put the oxygen here, the pulse oximeter, and then I got a 98% for oxygen saturation level, which is normal. And now I'm gonna get his blood pressure. So for the blood pressure, I'll put my stethoscope on. I'll palpate the brachial artery, and then I'll place my stethoscope on the brachial artery. Where is it? Alright, I'll just use this thing. Alright, and then I got a 120/80. Alright, and then I'm gonna go on to the other side again. Now we're gonna be inspecting the head. So overall head shape is normal. I don't see any lesions. The face is symmetrical. What else? The face is symmetrical. Hair. I'm gonna now palpate the hair. No, there's no signs of any lesions. Everything's intact. The skin and lips are the right color, and the texture is normal. And now I'm gonna move on to the ears. And then, so I'm gonna point out the auricle, the tragus, and the lobule. And then it's all intact. There's no discharge coming out. And I'll be checking inside too. Everything's intact. Is there any pain when I feel your tragus? No? Alright, sounds good. Now I'm gonna check your mouth. Your mucosa is nice and pink. Tongue is intact. Teeth are all intact and all there. The gums are nice and healthy and pink. Your uvula is nice and midline. Your tonsils are there. Tonsils are there. Uvula is midline. That looks good. I'll check your nose. There's no nasal flaring, no septal deviation. Alright, everything looks good on your head. And now I'm gonna check your carotid artery. I'll do that one at a time. And then the rhythm is +2, and everything feels normal over here. And then now I'm gonna check for the lymph nodes. Well, actually, I'm gonna do the eyes first. So his eyes are closed, but sclera is white, conjunctiva is pink. I'm gonna check for lacrimal drainage. I'm gonna check for perla, so I'm gonna check one at a time. 1, 2, 1, 2. Pupils are equal, round, reactive to light, and I'm gonna check if they're accommodating. 1, 2. Alright, so all the eye muscles are intact because he was able to follow my pen light with a pen light. Anyways, I'm gonna check the lymph nodes now. I'm gonna do preauricular, postauricular, the tonsillar, the occipital, the anterior cervical, posterior cervical, and the supraclavicle. And then everything feels normal. And now I'm just gonna oh, and now I'm gonna assess for the jugular vein distension. And then he would be put flat, but then he would be raised 30 to 45 degrees. And then there's no JVD. There's no JVD, so we'll be able to continue. Everything seems normal. So now we'll move on to the chest. So first we're gonna inspect. The chest is symmetrical. The skin texture and skin color is appropriate to ethnicity. There's no signs of lesions or cuts or anything. Everything looks nice. And now we're gonna palpate. There's no signs of any masses, no tenderness. Everything feels normal. And now we're gonna palpate the cardiac landmarks. And that starts at aortic, pulmonic, herbs, mitral, and tricuspid. I hope that's right, but anyways. And then once we palpate the chest landmarks, we'll auscultate it. So we'll start here. Alright, so they all felt normal heartbeats, heart sounds, and then we're gonna move on to respiratory. So he has, like we said, he's able to breathe through his nose. He's able to breathe sitting down comfortably, laying down, in all positions. He's able to breathe comfortably. There's no excessive movements, no involuntary movements. And now we're gonna listen to his respiratory, his lobes, all his respiratory lobes, and in the lateral movement. I'm losing over. Sorry. I'm released. Alright. So now we're gonna listen to it in the lateral movement. And breath sounds were nice and clear, and we'll listen to it posteriorly as well. And now we listen to it posteriorly, and the breath sound, the lung sounds were nice and clear. And now we're gonna check for the thoracic expansion. I'm gonna ask him to breathe and see if I can feel any abnormalities. Everything feels normal. So now we're gonna move on to the abdomen. I'm just gonna cover him up. First, we're gonna inspect. Everything over here looks normal. The color and textures is appropriate to ethnicity. And there seems to be no cuts or any lesions. Now we're gonna palpate. Actually, yeah, we're gonna auscultate first, because if I palpate, then I would make the vowel sounds different. So we're gonna auscultate first, and then we're gonna listen to the 4 quadrants. Left upper, right lower, and then left lower. and then the bowel sounds were active, and now we're gonna feel for any distension or any abnormalities. We're gonna palpate softly. Alright, everything feels normal. And now we're gonna check his genital area. So his genital area, everything seems to be intact. There's no discharge coming out of anywhere. The skin seems normal. Alright, so we're just gonna move on from that. And now we're gonna check all his peripheral pulses. So we did his carotid, but we'll just do it again, and we'll do that one at a time. And that feels normal. We'll do both of his radial pulses. We'll do his femoral, which is right over here. Popliteal. I said popliteal?
Yeah.
Popliteal and the posterior tibialis. And then the pedal pulse. And then since we're here, we're gonna check for edema. And there's no edema over the bony prominences. All the skin is all normal and contributes to ethnicity. And now we're gonna check the capillary refill. We're gonna do on all 10 fingers and toes. And we're gonna make sure it's all under 3 seconds. And just for time's sake, I'm not gonna go through all of them, but you have to. Alright, and then we're gonna, I think I did forget to say this, but we're gonna assess the neck range of motion. So can you please push against my hand, like look right or left? Alright, thank you. And now can you look up, down, right, and left? Thank you. And then we're just gonna cover you up a little bit. Can you go hold on to my hands so we can assess your strength? And we'll do that both sides. Strength is nice and equal. Now we're gonna do it with the feet. Can you push on my hand like they're gas pedal? Now can you point them towards your nose? Thank you. And now we're gonna perform some active range of motion. So we're gonna start with abduction, adduction, flexion, extension, supination, pronation, and circumduction. And now we're gonna cover you up. We're gonna leave the call light by your side. We're gonna lower the bed. And if you need anything, just hit the call light and we'll be able to help you.